even if it's hard and you know it's going to be hard, you got to fight through if
Um,
it's really what you want to be doing, right? Amy,
exactly.
how's that journey been for you in the States, at least?
My biggest vision is to change healthcare, and it's not necessarily women's healthcare, it's healthcare in general. And so I think we have to also think bigger and broader. Women have babies, but guess what? The man also is needed for that baby as well. So, maybe if we just think of it not as women's health, but people health, and this is good that we can help reduce some of the stigma around women's health. I agree. We haven't been in clinical studies. Everyone shows a stat that like women haven't been included in clinical studies, only in the last few years. But even now today, the studies that they're doing, a woman has to be on birth control or postmenopausal because they don't want the confounding issues with pregnancy or hormones in the data. And so like it's an uphill battle and challenge, but when you're pitching investors, if you can help them see it's a healthcare problem, not just a women's health thing, or oh, you know what, I didn't deal with infertility, or we never had miscarriages, so it must be a small problem, but to show that this is I mean, not being able to reproduce our next generation is a global crisis. Global crisis. Think
Well
about that.
said. Yeah. Yeah.
I would say like in the femtech and startup space as well, like that was one of my biggest surprises when I was entering this field was how difficult it would be to fundraise in femtech as a woman. And there's brilliant research by someone called, I will pop it on the chat. I think it's Ludovica Castiglia. I'll pop it on the chat, but she did amazing research on like gender funding disparities in femtech and how women founders are likely to receive less funding because investors maybe think that they're socially motivated rather than economically. So if you have a guy on board, they are doing it because they know there's profit. But it's like a catch-22 because there's so many issues that women deal with in silence. And we need to spread these issues. We need people to know the struggles. But the catch is if you're doing that, you're then seen to be more socially motivated. And there's this Ludovica has done amazing research on it. It's really interesting to see. But yeah, I think it's very interesting topic.
Like Amy said before, I think looking at the global impact of health issue is a very, very right perspective also on my end, because if you are, I think single indication companies take a huge risk, because if something fails, and there's so many places along the difficult road where it could fail, right? If it's clinical study, if it's go to market, if it's sales, then it's the end of the story, right? So if you have at least options, then you're in a better position. And in EndoCure, we actually started, as I said, from women's health, specifically from endometriosis, where we realized there's a huge, significant unmet need. But I quickly identified that our solution can be a platform for many other conditions, not necessarily women's health, but also general, like cancer. Could be bladder cancer, prostate cancer. So we do save some indications for men as well. And other conditions like kidney stones, Crohn's colitis, and actually everything that ultrasound can do, we can do better, we can upgrade.